All right, folks, good afternoon. And it is certainly that time of the week, and always looking forward to spending some time with you guys. My colleagues and I always look forward to this day of the week. And this is the Marketplace Reset and Jumpstart TV, broadcasting live on WSTX 970 AM, broadcasting live on the Kalalu Network, on Jumpstart TV, broadcasting live on YouTube, broadcasting live on several destinations on Facebook, and rebroadcasting on Tempo Television, and we're live on our Hispanic station, La Mega Mundial. Pleasant good day to you all. Hope you had a good week so far. Your week has been productive so far. I want to say hi to my colleagues, Linda and Caroline. Ladies, how are you doing today?
Fantastic. How are you?
We are doing well.
Fantastic. So we're back to our original time, ladies.
Wow.
Is that our original?
What a year.
Wait. You don't sound excited. What?
I don't know if is that our original time?
We don't.
Yeah,
know what
12:30.
time it is.
12:30 is when we kicked off. It was 12:30. We had to make the adjustment, and now we're in a brand new year. So I figured we go back to how we came out of the gate.
Okay, so we're going to pretend daylight savings time didn't happen.
No, wait a minute. No. Well, I'm still an hour ahead of you. I'm still an hour ahead of you. So, let's not push the envelope too much.
Okay, very good. All right, I just want to
good. So how you been?
It's been a busy week. Yeah, this is Wednesday, and think about it. Just think about it. In the month of January, just how profound our Wednesdays have become to us, right? So when we think about the last 3 Wednesdays, in the midst of all of this, we've inaugurated the first African-American, first Asian-American female vice president. We have a new party leadership in our House of Representatives and in our Senate. We have historic cabinet members who have been now, confirmed, the most diverse in women in top leadership. We have some of the most daunting numbers in terms of COVID. We've now close to 470,000 souls lost, over 100 million cases, and how many new strains of this mutation? Where are we on that?
The mutation
All
of
the
this
mutations, yes.
This new variant, and it's turning out where they said it wasn't as deadly, it was more contagious, but it wasn't as deadly. Now it's turning out to be both very contagious and deadly. And when I last heard, it was in 22 states, right? That's what I heard. Correct me if I'm wrong. And this thing is just really spreading like it's nobody's business. I mean, what's going on here?
Well, when we have we all know the story. When you have super spreader events, and those individuals have coming from all parts of the United States and return home, it's just a wonderful petri dish for disaster. And it's sad but true. And so we hope that individuals will contemplate getting the vaccination when they become eligible, learning about it, understanding their health status, talking to their healthcare providers, and then moving forward accordingly. And not letting naysayers or those who are scared or who are against any type of vaccination for any reasons really have them make their individual decisions. It's going to be an individual personal decision before it becomes a universal societal mandate like as you have in school. So we're really excited about the guests.
Well, this is the health and wellness segment. Mm-hmm. So I'm always looking forward to hearing from your guests and
Yes.
what the focus of discussion is. Obviously, it seems like this new president, the Biden-Harris administration, President Joe Biden, has come out the gate really strong with a laser beam focus on really, declaring war against the COVID-19, and is throwing everything he can at this. I believe he said he wanted to have about, he's now going to do away with the phasing of the vaccine, and now talking about, by April, have 100 million Americans vaccinated. I mean, the President Joe Biden is really, he's really tackling this thing in a big way, and I'm really excited about that.
Yes, he is, and we're really excited about it. I also know that we just want to make sure and support the administration, regardless of what side of the aisle you're on, that it is a thoughtful, contemplated plan that can be tactically implemented without another degree of challenges for communities, but that it can actually be effective as we go forward. And collecting the data around it is going to be critical as we go forward. We are hearing the horror stories of people passing at 2 weeks later, from getting the virus, getting the vaccination, but we have really no data that associates one event to the other. So we don't want people to walk away scared that, oh my goodness gracious, this is going to happen. The mask mandate, the 100-day, which is now dwindling down to what, I don't know how many days left now, 95, 96, 90. He is putting in place the kind of policies and procedures and things that we need in this country. But from
Absolutely.
a contemplated plan is where we're going to be able to drive and get the spread down, get the infections down, get the deaths down.
So who do we have on today? Who is your special guest? Talk to me about that. They're in the studio. They're patiently waiting. They look like they're ready to go. And so who do we have on today?
We're really excited. Obviously, Linda and I are very, very concerned about our health and that of others. So we have the developers of a product that we feel is going to be really, really helpful and safety protocols as it relates to what we personally can do with COVID. So we have Dr. Stephen Barone, who is a co-founder of this company, Halodyne. And we also have his vice president of marketing. So they're going to talk about this product, but I'd love to give you some background on Dr. Barone, just so that you can understand the nature of his medical background. Would you like me to do that with them in the studio? Because I'd like to read a little bit of his bio. What are your thoughts?
Sure, just go right ahead. They're right there, and share that with them.
Great. Okay, good. So Dr. Barone has served as the senior medical officer at the U.S. Food and Drug Administration. And in addition to that, he has also served as a chief medical officer to Avalanche Biotechnologies, and then a senior vice president in clinical development at Adverum Biotechnologies. Both roles included supervision and implementation of clinical development of AAV gene therapy products and also rare diseases. Currently, he serves as the chief medical officer for Veloce Biopharma, which is located in Florida. And so he brings a wealth of experience, information, and just an incredible background. And then we have Danielle, who she's as excited about the company as we all are. And she also has an extensive background, but she works as it relates to the marketing support of this incredible product. So those are our lovely guests for today, and we're happy to have them here.
Welcome.
Happy to be here.
Thank you so much for having us.
Wonderful. So we're just going to hop right into, that was a great introduction, Carolyn, because it's so important to have our listeners and our viewers understand the real strength of what Halodyne and its founders and those who are in leadership are bringing to this conversation, but also bringing to the product development, which is something that we're very excited to talk about and show and demonstrate and give some opportunity to really understand the science behind it. So why don't we just hop right into it? How about that?
Great.
So my very first question is, if I didn't know better, can you tell me what Halodyne is?
Yeah, sure. So the short answer and the easiest way to think about it is that Halodyne is like hand sanitizer, but for the nose and the mouth. So it's a proprietary nasal and oral antiseptic that works to kill the virus at the site of infection. So we know that the COVID-19 virus, it infects the cells of the nose and the mouth. It replicates in those cells in the nose and the mouth, and then that's where it's spread from. So that by decontaminating these surfaces with nasal and oral antiseptics, we are able to then decrease viral transmission.
Wow, that's a mouthful, and that sounds exciting. Let me ask you this. We have COVID-19. What prompted you to come up with this? Was this developed specifically for COVID-19?
So the Halodyne company started, yes, because of COVID-19 and this specific product. You went into my background. I've been working in clinical drug development for almost 11 years, had experience at the FDA. And our parent company, Veloce, was working with topical antimicrobials for different indications in the skin and in ophthalmology with some penetration enhancing. And then when the pandemic hit, we recognized that, hey, we had this great experience with this great compound, and how can we make a difference? What can we do? As a physician, we had some additional conversations with some of our other now co-founders. One specifically is an ear, nose, and throat specialist. And he said, look, anytime I'm seeing a patient in my clinic, as a nose specialist, he says that I stick a camera up every other patient's nose to see what's going on and make the diagnosis and help with their treatment. But that's going to spread viral particles, right? That's going to spread particles that he needs to protect himself from. He needs to protect his staff. He needs to protect his other patients because these are happening, indoors and in the office. But he has experience working with the active ingredient in our formulations. And he said, look, you guys know how to develop it. It's safe. Let's get it into a way that we can make it accessible for a lot of people, because this has the opportunity. I mean, specifically, we were looking, or at least initially, we were looking to, from those healthcare perspectives, how can we open up clinics? How can we get people back to being seen in the healthcare office? So with that background and with our knowledge of the of drug development and the active ingredient and formulations, we said we're in a position to make a difference. So then we tested it, right? We said, well, does it actually work? We have this hypothesis, but does it actually work? And we tested it against the SARS-CoV-2 virus. We were one of the first groups to do that because, this was in April, actually. There was a lot, much more unknown than there is right now, right? So there were very few labs that actually had the virus that were able to do some investigations into it. But we were one of the first to be able to test our formulations against the specific SARS-CoV-2 virus, the COVID-19 virus. And we found that we were 99.99% inactivation within 15 seconds.
Wow.
So, once we had that, we knew that we were, really onto something, that this is more than than just an idea. And let's really work to get it out there.
Wow.
That's amazing.
So that's a very interesting that you went into your own clinical trial in this, and the testing and your investigation revealed and that was early on in the fight. And do you continue to do testing as the new strains are presented, as we are now coming to understand these mutations, quote unquote? How does that come into play with your ongoing efficacy?
Yeah, so there's so much that's being learned daily. There's so much science. There's so many people dedicated to working and trying to fix, trying to look for ways to help in this pandemic, because it's just it's impacting so many people. So many lives have been lost. So many impact to economies, etc. Truly unprecedented. So we continue to work and to study and contribute, right? How does our compound, how is it able to help? Now, the key is when you start talking about different strains, even different types of viruses, that may, what's the next virus that may be coming, or what's the next, even flu. Our compound and our formulations are effective against all of those. They're very nonspecific. The active ingredient is povidone iodine, which has been used by the World Health, or it's been used in medicine for over 50 years. It's a World Health Organization antiseptic, essential medicine for antisepsis. So it's very safe, and its efficacy is well known. We were able to make it safer for the nose and the mouth by in the way that we have formulated it. But it's very nonspecific. It has a very broad antimicrobial abilities. It kills everything: fungus, spores, bacteria, all viruses, and there's no known resistance to it. So we're confident, and we look to check the box to make sure that Halodyne is effective against some of these other things. But when you start looking at the nuances or the fine points of the mutations, that's not going to impact Halodyne's ability. It's going to kill all of them.
It almost sounds like something that you shouldn't believe, but I absolutely believe it, because you're explaining the science. So you indicated that it is basically a sanitizer for your nose and for your mouth.
Right.
How do I use that? That's question number one, and then I've got a quick one to follow that.
So I think that's on something very important there. I mean, that it's not a cure, right? So it's something that is an additional layer of safety. I mean, earlier in this, during the introduction, you were talking about, getting every possible mechanism, everything that's, the whole armamentarium, if you will, of things that can potentially help. So this is an additional layer of safety. Again, like hand sanitizer, but for the nose and the mouth. So you wash your hands, you use hand sanitizer, but there's still a role for gloves, right? So similarly, we're wearing masks, but there's limitations to the masks. Unless you have an N95 and it's fitted, there's around the mask. It's decreased, but there's still airflow around the mask, so they're not perfect. And consider the material that the mask is made of, and the compliance that you have to wear it over your mouth and your nose and not have it down under your chin too, right? Which is hard. You're talking, you're interacting. I mean, it slips down. So all of those things are challenges in that, but the mask provides a physical barrier like gloves do, but this is a chemical barrier at the source of the infection, just like the hand sanitizing is. So it's in addition, it's an additional layer of safety that people can use whenever they are. Again, we started it for the healthcare setting, but we recognize this is so broadly applicable, and more people that we talk to, and Daniela can point to some of that, all the how we're selling it and to the people that we're selling it to. But it's anytime you are interacting with a lot of different people for an extended period of time, and that you in close contact, this can be an additional layer of protection on top of the normal ABCs of the CDC that we all should be doing.
So someone would actually, because we are hearing, obviously a lot of the spread, because we're just coming out of the holidays, has been around these small group gatherings of family members who believe because we're family or we're very close friends and we know their habit, we know our habit is similar. However, we have now come to see that has been a challenge, where it has created that perfect storm of potential spread. Are we saying that someone, as an example, would sit down to dinner, would take their mask off, would spray their nose to kind of coat themselves, if you will, maybe spray their mouth and proceed? Because if you're sharing dinner with a family or, very close guests, you're in a position of closeness, the social distancing may not necessarily work. Is this a barrier, therefore, to the potential of being infected?
Yeah, definitely.
Think about kind of the practical application. I think our listeners and viewers would want to understand to walk them through that.
So that's why when Sam stated that initially we started this for the healthcare industry, we then noticed fairly quickly that basically everybody needs this. So just like you're sitting down to dinner with your family, definitely you would take, you know, I have the swabs here with me. So it basically comes in a little capsule like this, and you easily just break off the tip, and it already has a swab application ready to go. So you would basically swab this in each nostril, and this would be disinfecting your nose. And then we also have, which I don't have with me right now, but we have an oral spray or an oral rinse. The oral rinse you mix with water, and the spray you just easily spray in the back of your throat. And then you would place the mask over your nose and your mouth. So it gives a double protection. But of course, when you're eating with the family, you don't have your mask on, obviously, because you can't eat. It's great to have Halodyne because you can freely, you know, have this intimate dinner with family for the holidays, for birthdays, or anything like that, without really having to worry. So, and even for just any type of events, because I know that I use it before, you know, I go to the grocery store or I run errands, or if I have to network or go to a meeting, it's just something, you know, an extra layer of protection that everyone can do before they put their mask on. Like, just like Sam said, like sanitizing your hands before you put gloves on, it's the same concept where you're, you know, sanitizing your nose and your mouth. So, you know, this is really for everybody, and we're trying to spread awareness right now. We had a national campaign that went out last month, and we're really trying to spread awareness on, you know, disinfecting your nose and your mouth as a double layer protection along with the mask, because, you know, the vaccine is here, which is great, but it's still new. It's not available to everybody yet, and you know, this is something that's not going to disappear in 2021. Unfortunately, you know, it will get better, but it's not going to disappear. So this is the new normal for us. We have to, you know, put this as a part of our lives as a new normal until things actually get back to normal.
I think I'm going to always want to have something like that in my toolkit. So what I was thinking and what I'm hearing, because Linda asked the question, you know, after I have dinner, I would do this I'm with my family, but you're saying do it and then put your mask on. So it's going to be, so anything that I would inhale or breathe in as I'm out, it's going to be taking care of that then. So now that I've gotten home from Costco and from the grocery store and I'm unpacking groceries, once I remove my mask and everything, should I do that again to take care of it? In other words, is this a pre and a post, you know, contact with people, or?
Well, this lasts up to 4 hours. So we have, you know, consumers doing this every 4 hours, especially the frontline workers. They have their 12-hour shifts, so they'll be doing it, you know, every 3 or 4 hours. For travel, I mean, this is something that you shouldn't even leave the house without. You should definitely do it every 3 to 4 hours when you're traveling, because that's when, you know, you're just in contact with so many people, and you know, the plane is very contaminated, and a lot of people have contracted COVID from the airplanes. And this is actually fights against not only COVID, but, you know, influenza, like any type of virus. So, you know, the longevity of this product is great because it's not only for COVID. It can fight against any type of virus that we have in any season that comes.
That's exciting.
Unmute myself there.
Okay, sorry.
So I was just thinking, my goodness gracious, tell us a little bit, if you have worked with clientele, kind of helping to put this into their reopening strategies, because part of President Biden's focus for, let's say, schools is in the next 100 days is to look at how can we get kids and administrators and faculty back into the actual classroom because of the low learning threshold of what some of our students are experiencing by being within a virtual environment. Have you found there's some industries that are really just locking in on this product, and therefore, you know, it can bring out the imagination as to where else and how far and wide your product can actually be spread?
So I think one of the big ones that and Daniela hit on this earlier, one of the big ones that's really been sort of adopted or looking, taking it on board, really taking it to heart is particularly the travel industry, where we're in some duty-free stores, and it just makes so much sense when you are traveling. I mean, we certainly are having discussions. We have availability to try to be able to help all of those, all education. We've actually had an event where we had donated. It was to some more along the lines of essential workers, but these were school bus drivers, right? So they're the ones who are moving kids around and to protect the kids from being exposed. And themselves from being exposed. That's also been very helpful. We've also had some very good discussions with some other types of mass transit as well, to protect those essential workers who are very much at the front lines, because not in addition to their close contact, right? But mass transit is how people get to work, right? It's such an important part of the economy to be able to move people from places to place as well. So those seem to be sort of like the kind of two biggest ones. And then a lot of ones also where the normal ABCs, like the PPE stuff, is a challenge. So there's reasons why people can't wear masks or have an inability to wear the masks, where you think about we've had some in athletics and college and pro football use where they're not wearing their masks because they're out on the field, as well as in the entertainment industry. It's been used on sets where the people who are on camera have their masks down, and then it's like some really interesting feedback. It really gives them the confidence that, like, hey, I'm more vulnerable because I have my mask down, but look, I've done something else. I've taken, I've done another step. And so now I can get into character. It's easier to get into character. They're less distracted about what they, about external things, and they can focus on what they need to do for their role. So yeah, really, I mean, it's been very interesting from that standpoint of how it's sort of more people are adopting it versus others.
Wow. So that's a really interesting point, and it makes me think. One thing that was of concern to me is obviously everyone wants sports to reopen. It's a way we sort of decompress at home watching the sports. So have you had any major sporting organizations, reach out to you to figure out how they can get this, if this lasts 4 hours, which could potentially be a game, to get every single person swabbing their nose and rinsing their mouth before they get out on the court or get out on that field? Have you had any outreach from sporting organizations?
We've had a few teams that have been used it, adopted, and made it available to their players. It's I think there's a level of invincibility that young athletes, young professional or top level athletes think about themselves, and are less, oh, that's not going to happen to me, or I'm not going to need it. So it's been kind of hit and miss. And and the other thing, this is while we're trying, and we greatly appreciate the opportunity to be able to discuss it and things like this. It's something new, right? Just our culture is not used to this type of a product or doing this type of extra step. Like, yeah, everybody knows about hand washing, and well, we've seen masks before, and even that's been sort of hard to adopt and for different purposes, and people to be wearing masks. But then some of these other steps, and like our product or some of the other things that you're doing, and I think that's sort of the biggest challenge is like what's real, what's above the noise. I mean, we have the science to back what our data, or to back that we're real. But there's a lot of noise that's out there too, and people are trying to recognize what's best.
Wow. I saw Anthony on. Normally when he peeks his head in, that's because he wants to engage.
We need to take a break. We need to take a break. When we come back, hold that thought. We'll take a quick break and we'll be right back. Folks, you're listening to The Marketplace, and this is the health and wellness segment with my colleagues, Carolyn and Linda. We'll be right back.
The reopening measures are slowly taking place amid the coronavirus pandemic. Malls and restaurants are working again, and factories move more and more of their personnel back into the offices. However, that doesn't mean that people won't get sick anymore. On the contrary, there are now many more chances of spreading the virus even farther. To protect the employees and clients of your business, we developed thermocontrol screening stations. It is a quick and safe solution. Thermocontrol measures temperature at a distance of 25 centimeters. The device is autonomous. It does not require an additional employee to conduct temperature measurements or log the results. It can measure and even recognize masked faces. All of the results are logged automatically and stored in the database. You can use the station to ensure your clients and employees access to your building automatically.
John Smith, Brombach.
The station can issue entrance passes and grant access to the building after it measured the person's temperature. If the visitor's temperature is high, a notification will be sent and a potential carrier of the virus can't access the building. Thermocontrol can send SMS and messenger notifications, as well as notifications over email. Temperature measurement technologies allow businesses to ensure the safety of people and potentially save lives all over the world.
All right, we're back.
Well, you can't hear me if my mic is muted.
I know, right? That's okay.
Yes, and I just want to make sure that we're having no technical issues, as everyone can hear everyone. So this is great because live television and live radio can be that way. But we're having this great conversation around an amazing product that can protect us from not only COVID, but also other viruses, airborne viruses. And we look forward to the second part of our conversation with Dr. Barone and Ms. Danielle Lucas. So welcome back to part 2 of our conversation. And we just want to acknowledge something. You're making history with us, because since we started our radio and television hosting of this particular part of the show, the health segment of Reset, we've been 30 minutes. Now we are inaugurating an entire hour, because we have found that the subject, it just goes quickly and there's so much information. So we appreciate having you on as our inaugural guest for our hour-long program, our hour-long segment. So We left out the conversation with the types of industries, and we talked about the sports, and that sometimes individuals do feel that they are really actually immune to this process, that they're invincible, as some people believe. The question that I have for you is, are there some side effects, or if any side effects at all, perhaps none? And what are you collecting as data that can help individuals understand where we are today with the product, and how, really what we need to do? So those are two questions. I'm gonna get all my questions out, and I'm gonna mute myself. Let's just have the floor. And then the third is, do you believe that this would create, and how do we get a public awareness campaign to say this is not an alternative to wearing your mask and other health practices around COVID safety, but rather in addition to, and a smart strategy for personal safety? So those are my three questions.
Great
I'm gonna
question.
mute myself.
Well, I guess I'll take the last one first. And when you talk about the strategy, or public health or public awareness campaign, I mean, I think we need to start with the awareness campaign of Halodine's available, right?
Great.
And then and get people to use it. And yes, of course, with that, and what we always try to say, and what I said early, is that this is not a cure. This is something that's just as an adjunct. It's in addition to the things that you're doing. So I think it's just part of the whole education about what is Halodine, how it can help, how can people get it, and what are the right ways to use it. In terms of safety, it's very safe. I said that the active ingredient is povidone iodine, which has been used in healthcare for over 50 years for its antisepsis. It's generally regarded as safe and effective, like by the FDA, such that antiseptics that have this active ingredient, essentially they just have a green light. So it's very good to know from that perspective. And there's a lot of data that are available in literature and the scientific publications about the safe and effective use of povidone iodine. And personally, we've been working, our team internally, we've been working for over 65 years with the active ingredient. So we're very familiar with it. We've done studies before with some of our parent compounds where have collected data and demonstrated the safety. And again, as physicians, we wouldn't be trying to bring something to the market that is, that was unsafe. And we have a lot of peer-reviewed scientific literature that points to the safety, the effectiveness, and potential that it can use in the pandemic. I think that, and then was the third one was about additional data. Or
yes,
what are we doing? What are we doing?
Data.
Yeah. So in addition to some of the studies that we're looking at in the lab, and how can it work against other viruses that might be coming into play, or other very resistant bacteria that are, like, for example, common in the in hospitals. We do surveys where we look at the way that people who are using our products. And what are they having any side effects? What are they reporting? Really just like how, in addition to just how are they using it from like market research standpoint, but really looking, diving into the tolerability and if there are any, significant issues that people are having. As expected, there aren't any. Again, it's, you said it's very safe. We were very comfortable about moving this forward, but we still have collected those data to be able to say, hey, yeah, look, it's really not a problem.
I love that. So then, and just to kind of reemphasize that, so small children as well as the elderly can use it. There are no age limitations. There are no pre-existing health conditions that would preclude a person from using it. Is that what I'm hearing?
So we On the label, and this because is sort of based on what's kind of standard for this class of povidone iodine antiseptics. We recommend speaking with physicians, the pediatrician or the dentist for that matter, if you're using it below the age of 3.
Okay.
And then similarly on the other end, on the high side, there's no limitations from an age perspective. I think that the two big things that people ask about in particular, or maybe use some caution or want to be able to talk to their physician about some more, is if they have an iodine allergy. And there's really, it's actually kind of a misnomer. Because there's really no such thing as a true iodine allergy. Iodine is a molecule that we all have in our body, and it's an important part of thyroid function.
Okay.
So when people people talk about having an iodine allergy, it's usually to a compound that contains iodine, but it's actually not the iodine part of the compound, it's to something else in the compound. So when people have an allergy to shellfish, for example, they think they have an iodine allergy, but it's another part of the protein that's in the shellfish. Or contrast dye is another common one that people like, oh, they have a allergy to it. So on our label, we talk about if you have an allergy to iodine compound, you should use caution. But a true povidone iodine allergy is very, very rare, and people who have had problems with contrast dye or with shellfish, they still have been exposed to povidone iodine potentially through a surgery, and they haven't had a problem, and our concentrations are so low that it's low risk, but people should still use caution and talk to their physician or thinking about that. Similarly, when I mentioned thyroid disease, that one comes up a lot because iodine like as I said, is an important part of thyroid balance. And so people who are on thyroid medication, either for being hypothyroid, they have low levels, or hyper, they have high levels of thyroid hormone, and it can actually affect sort of both ends of the spectrum. Is in terms of iodine and systemic absorption of iodine. But again, the key is this is such a very low concentration that people would be exposed to through Halodine, and then the amount that's actually absorbed is very low. So it's unlikely that there's a problem, but again, we recommend people having that discussion with their physician, or to get their thyroid levels checked if they're using or planning on using Halodine regularly.
Okay, so I would, just in case we have listeners and viewers that are tuning in right now, I want everybody to understand that we're talking about a wonderful product that is on the market, that is designed as an extra layer of protection for us, much like washing our hands, wearing a mask, using hand sanitizer. This is a sanitizer for your nose and your mouth that is effective for up to 4 hours as we're trying to go back into our day. The question I would have immediately, and I do have, is how can I get it? Where can I buy it? Danielle, you, Dr. Barone, where can I get this?
Well, we have it available on many locations on our website. We are on Amazon, as well as thousands of pharmacies and retail chains across the nation right now. So we're easily available to any consumer, and you can either get us online or at your local pharmacy for some of you.
That's wonderful to know. That is absolutely wonderful. How many units have been sold so far, if you can share that information, since you went into production?
So we actually surpassed the 1 million mark in unit sales during our first year, which was definitely beyond any of our expectations.
Wow.
So we're very happy and excited about that. We've grown very quickly in the last year.
That's exciting. Congratulations. That's fantastic.
Yeah.
That is
Yes,
absolutely.
indeed. And we talked a little bit, that is astonishing, and we hope for continued success, because we want everyone to really think through how to keep themselves safe and that personal responsibility in addition to all that they're doing. Now here's yet another opportunity. My other question relates to this. Can you share with us if there's any age limit, who's really your target audience or target clientele? Is it, is it safe for those who qualify, young children all the way up to elderlies? Can you give us a little bit of understanding as to that marketplace?
I think Sam touched on that a little bit, how, on our label, we just provide a standard to just check with your physician if you're under 3 years old, but there really is no age limit. And our target audience is really everyone, because, everyone has to leave their house at some point. And I know a lot of people are working from home right now, but that's not the case for everyone. The hospitality industry, retail stores, for the athletes, and anything in the entertainment industry. And then if you are working from home, you do have to, run errands. There are things that you're going to have to go do, and maybe even go out to a dinner, and just feel a little bit normal. So really, right now, I don't think we're targeting a specific industry. It really is, we're touching on every single industry right now.
I love that. That's really exciting as I think about, I'm sorry, Linda, go ahead.
Asking myself this question, if I were a legislator, oh, can you hear me? Is everyone good? Okay. Because I'm wondering, how can we take this up to another level, a policy level, something that allows for our legislators to really understand the science as well as the practical application of products such as yours, and what we do to help reopening strategies, safety measures for our essential workers and our workers who are with communal organizations, meaning, as you mentioned, the bus drivers, as you mentioned, those who are working in departments of corrections, those who are working in homeless shelters, places where we have communal gathering because that's the nature of it, schools. How do we help, or have you done anything in the government affairs space to be in a position to connect that public policy with that, and that health policy to the private industry, focus on COVID response with this type of a product? How have you bridged any of those kinds of conversations with our legislators, or local, state, or federal? And Dr. Barone, you'll have to unmute yourself there.
Dr. Barone, thank you.
The short answer is yes. We've been continuing to knock on every door that's possible, that's possible to us, and continue to have those discussions. There's been a couple of municipalities that we've been working with directly, and one of them just found out that they had submitted it and they got FEMA reimbursement. It's a really exciting. So this municipality was able to get FEMA reimbursement for their for the use of Halodyne. So that's very helpful, and that's we believe that will help us to continue to open doors. I guess it's a sort related. We just think about it in the government affairs or government bucket. We're also about to get on we've been accepted, and so it's in review right now on the GSA schedule. So we anticipate that that's going to be coming up imminently. And so, through these and through our outreach, through doing opportunities like this, we are, looking for ways to be able to get our foot in the door, have those conversations, introduce it, discuss it with the legislators, discuss it with the decision makers, because the more that it can get out there, the more support that can be for its use. That's where it's going to be, very helpful as an additional layer of protection for people to be able to, use it. Because I think right now, unfortunately, it's sort of there's a cost to it, right? and so a lot of it's you're asking about institutions or asking about employers. There's not. They have a challenge of putting this extra cost on top of all the other things that they're already doing, right? And so if there's mechanisms where there can be additional support so that their staff doesn't have to think about, like, I have to go get it myself, right? And spend the money myself. But if there's additional mechanisms where there can be support for employers and institutions to be able to do it, that's going to be great.
Well, Dr. Barone, I'm so glad you mentioned that, because even the product that Linda and I, the company that we have that provides the thermal screening stations, these thermal screening solutions, we let people know that qualifies for state or federal COVID dollars. So understanding, employers have often had wellness programs for their employees. If understanding that this qualifies for COVID dollars, now takes the expense off the employee, and it becomes a benefit add. So that is a huge strategy around getting more people to have this. If you're going to make me come back into the office, as long as I have Halodyne that is available, I get 2 units a day. I can do my 8-hour day there and feel good.
Yeah. Yeah, exactly. I mean, that's always the yin and the yang, right? About spending money on prevention and being able to dedicate resources. I mean, that's such a challenge for our legislators to be able to think about that. But the more that can, your product, again, all these products, it can be very helpful to be able to stimulate back to work, stimulate the economy, more activities. People being able to engage and do economic travel, buy things, go to restaurants. So.
None of that can be downplayed. So when I think about it, for instance, this show is broadcast from the U.S. Virgin Islands. And when I think of all of the real economic impact on tourism, this makes me, I would feel better going to a restaurant where I knew that every single employee, that once they checked in and they did their regular safety things, that everybody had just Halodyned up before they came to offer me something to eat. Or if I'm going to go and interface with somebody to get on the train, get in the air, to get on an airplane, to just know if that were something that were handed out at United Airlines for me before I enter the plane, while I'm waiting in that area, everybody's given a swab up, let's roll out. We got a 3-hour flight. This is going to last me 4 hours. I think that's an incredible value add. I'm ready to go do that now. I feel better just knowing this exists. So how did it get its name? I hear the iodine on the end, but what about the halo? I always love how medications get there or products get there.
So it comes sort of, I guess the root of it comes from the class of the halogen class of compounds that the povidone iodine is in, and so that's why it was kind of a nice kind of blend. But I think more importantly that I think of it also sort of dovetailed or was together. It's a halo. It's a protective halo. So whatever you're doing, this is again an extra layer of protection for you to surround. I mean, we had some debates about, do we want a little make it an angel, or do we want to make it look more, we have it yellow but more like a circle, like a halo on our label. But the idea, I think people get the idea, comes across.
Do you have the package handy so that folks know what they're looking for if they're looking on Amazon or they're looking for it? Okay, great. Halodyne.
Yes, that's the 6-pack for our swab sticks that Daniela held up. And then we have, this is a 10-pack of our oral rinse.
Wow.
So that's a little oral rinse capsule. You just twist off the top, and sorry.
That's okay.
This is the box for the the oral spray. And this is what the oral spray looks like. Just a spray bottle, 2 multi-use. So this is the only one that's multi-use, but with the spray and then the swab that Daniela held up before, those are our 2 big, really consumer-friendly products. Make it real easy to do. You can keep with this little box, and it's very thin, fits easily into your purse or pocket, for if you're on the run. So those are the things. Halodyne.com is our website.
And then I can obviously go on Amazon, and it comes in a number of different quantities. You mentioned a 6-pack that individuals could get, but they can buy larger quantities as well, correct?
Yeah, absolutely. Because our initial things was for the again, thinking about healthcare. So we have bigger, we have 100 packs.
Yeah, this is 100 pack of the nasal swabs.
Oh, wow.
Yeah, and then we have a 96 pack of the nasal antiseptic. We do have larger quantities, especially if it's for a company or for the healthcare industry. The smaller packs are just easy for for us, the everyday person, to pick up at the pharmacy and go. But also I know a lot of people that buy the boxes of 100 to have at their house because they're using it almost every day. So it kind of makes more sense to me to have the larger box at home.
All right. So as we round this up, this product is really quite unbelievable, but we can believe it because it has the science behind it. Is this FDA approved?
So we meet all FDA requirements. I had touched on before how povidone is so accepted, right? And so that means that we don't have to go through the normal approval processes of saying that, showing them our data and then saying like, yes, you can go ahead and put this on the market. Because of that, we are fully registered with the FDA, and we're able to to sell it. That's how we were able to get it out so quickly and be able to help so many people so quickly. It's manufactured to all FDA requirements, just like any other drug. So it's a bit of a nuanced answer about, is it quote unquote approved? It meets all necessary requirements to be able to legally market it.
Excellent. So, and we know a number of products fall under EUA, which is the Emergency Use Authorization from the FDA, which means they had the 800 years to go through the testing to prove it, but they know it's safe and hopefully effective. Anthony is on with us again. Anthony?
Yes, it's unfortunately that's how quickly an hour goes by.
I know, right?
How quickly.
Well, we really want to thank Dr. Barone and Ms. Danielle for coming here and really helping us understand. I feel encouraged every time I have something I can put in my toolkit, and you all have given us something very powerful today.
Thank you. Thank you so much for having us.
Yeah, it was our pleasure.
Thank you.
Wonderful.
Thank you so much. Thank you so much for being part of the program. Until next week, folks, that was my colleague, Carolyn and Linda, on the Marketplace Reset on our health and wellness segment. And we will talk to you next week.
Thank you.